if people could see what I see in our Māori staff and our Pacific staff, and they valued what they had to offer, automatically that would make a huge difference.
E te waiti e te waita, rauranga tira mā, e whakarongo mai ana ki tēnei kōnai ipurangi, nei a mihi karere ki a koutou. Kia ora. Welcome to Ao Mai Te Rā, a podcast where we're talking about racism, how it affects our health and what we're going to do about that. I'd like to welcome Gerardine Clifford-Lidstone to the studio. Kia ora hoa.
Talofa.
Lovely to have you here. Tell us a bit about how you came to work at the Ministry of Health.
So I'm the Director of Pacific Health at the Ministry, and born and raised in Wellington, and inevitably when you're born and raised in Wellington you start in the public service, and I found that a little bit boring, so went out to work in the community. My parents had started a not-for-profit organisation for Pacific people who experience adversity in social services, alcohol and drug problems, family violence, and they needed a bit of help. So I left my job, took a year's leave without pay, and went to help them out. And it just gave me insights into working with our community. It really helped me to think about my business background and using those skills to try and give our families a better start. And so that kind of led me into primary care, into consultancy, into the Ministry of Health originally. And so now I find myself here, 30 years in the health sector. Who would have thought? Yeah.
So it sounds like you've got such a rich background in seeing firsthand the impact of racism in the community. Can you share some of those stories?
Yeah, sure. Well, I mean, I think you always take it back to your own personal stories, and when you're a child of the 70s, you don't really think of things as racism. That was just life for us. And my first kind of real experience of racism probably was when I was about 5, and my sister and I used to walk home from school together in the Greek butcher because she was a lot more fine-featured than I was, a very pretty young child. I must have looked like the little Samoan girl. But anyway, he used to come out and say, "Oh, beautiful Greek girl," and give her a saveloy, and then just leave me standing there. So we'd share the saveloy on the way home. But,
Good she shared it with you.
Yeah, but what a stink guy.
Absolutely.
And then going to school, I didn't know that these were racist terms, but, you know, a kid used to call me bunga from Bungaland every day, or nigger from... And I just thought that was life, and I didn't even know that they were racist words. I used to think they sounded pretty cool, until I went home and called my brother a bunga from Bungaland, and my parents just completely hit the roof. And that's when they told me that these are derogatory terms and that they refer to your race. So, and then you start to become more attuned to the way teachers treat you, about how they perceive your potential and therefore how you perceive your own potential. So I became very good at being quite disruptive at school, but putting on this facade that I was doing really well at school so that my parents wouldn't find out, and you know, I'd get in big trouble. Moving into the workplace, it becomes a lot more overt, and I do remember going into places and just saying, "Oh, can I have a look at your strategic plan?" And mainly Palangi white men in ties saying to me, "Oh, don't read that, that's far too comprehensive for someone like you." And I think, well, what's someone like me? Is it a woman? Is it a brown woman? Is it someone who's just doing the dog's body work in the office, the photocopier. You know, you start to wonder these things. I particularly think of one experience where once a year the chief executive would invite all the other chief executives to come and have a Christmas function together. And it was kind of like the event in the public service. It was the event of the year. Everyone wanted to invite to go to the chief executive's Christmas function. And one day the chief executive's PA came to me and said, "Oh, Gerardine, they'd like you to come to the chief executive's Christmas function." And I was like, whoa, I must have done a great job this year, you know, really giving myself props, and thought I was the shiz. And then I went round and was completely blowed to everyone in the team. So I got an invite. Did you get an invite? Where's your invite? This kind of thing. And then she sent me an email to say, "Oh, and can you wear a black skirt and a white shirt because they like the ones like you serving them?" And I just went, oh. Wow. And then I felt like a complete dick because I'd already gone around and told everyone. So then I went round and told them all, they want me to serve them. Can you believe this? And that this was the public service.
That's outrageous.
Yeah.
Oh my goodness.
So, but you have, I mean, for me, I have to laugh at it, right? Because the other response is to get really angry and express your anger in a way that's not necessarily positive and that you would know would have repercussions on you further down the track. I laugh at that story.
That is a fascinating aspect, isn't it? That when we respond, those of us who are subjected to these racist behaviours and attitudes and assumptions, when we show emotion about that, it's used against us, isn't it? It's used to continue to position us in a certain role in society. Do you have some other reflections about that, about how you've tried to manage those responses in your career, in your role?
I mean, I think it gets more dangerous as you get older because it's the compounding nature of it. And when you look at the pervasive statistics for Pacific and for Māori people, and you know that you've experienced barriers that have prevented you from being the full person for no cause of, you know, you've had no contribution other than being brown and maybe a bit cheeky sometimes, then you become more attuned to the fact that when you raise your concerns and it's tinged with a bit of passion and a bit of frustration, that potentially it can be more lethal. And so you just constantly start to moderate because you think, okay, is this a battle I'm going to get into? Is this a battle I'm going to take front on? Is this a battle that I'm just going to take the piss out of because I feel like being disruptive? And that's not positive disruptive. It's like, you're not going to know that I'm taking the piss out of you, but I'm taking the piss out of you. And I'll give you an example of that. I go to a provider and they say, well, the church minister told us to come and see his congregation on the Sunday, but we're not going to go and see him on the Sunday because we don't work on Sundays. So my response to that is, oh, so the church minister told you when it would suit him, but it didn't suit you, so you've decided not to go. And they go, yes, exactly. And I go, well, that's fantastic. I'm just like,
Yeah, so it's all about it. Where do you think that comes from? Where do you think racism comes from? Where does it stem from and what fuels it? These people who are saying, oh, well, it suits us not to come on a Sunday, so we're not going to come. How do people maintain those kinds of views?
I mean, that's a really deep question that you've asked me, and it's a very complex question because I guess the root of it sits in colonisation. But then the way that it manifests itself sits in stupidity or ignorance.
Yeah.
And, you know, I heard one person say, what do we do for these communities or these people in the health sector who want to help but don't know what to do? So they're not doing anything, but they want to help. And it's like, are you kidding me? If I didn't know what to do, I'd go and find out what to do. And so I don't think that sitting there doing nothing is a good enough response, nor do I think it's a good enough reason to not understand how you can do things better.
Yeah. So in your role, we've talked a bit about the sort of interpersonal manifestation of racism and how we see that as we're growing up in our work lives. As someone who works at a policy level, what are some of the things that you notice about how racism can be hidden inside policy and well-meaning people maybe are not noticing it? What are some of your reflections on that?
Sometimes you need to be, I mean, this is real and this is real time. It's not something that I experienced last year. It's something that I see on a day-to-day basis. And people feel victimised if you raise it with them. So some of the examples I'm giving are not examples of someone that doesn't work at the ministry anymore. These are examples of what we see. And so looking at examples of people, they're doing personas. We want to develop a service and we're thinking of modelling this service around a Pacific person. So we've developed these personas. Do you mind having a look at them, Gerardine? First persona. Mele is an alcoholic, pregnant mother with 5 children and a husband who hits her. And it's like, are you seriously giving me this persona to review and think that all I can see is your misconceptions and your negative frame on this fictitious woman, Mele, coming through into your document, and you think that's how a Pacific person is? What about Mele has 5 children? She lives in a house. She works really hard for those children, but every day is a struggle. How can we help that Mele?
Kia ora. So, what are some of the solutions to stopping people coming to you with these racist stereotypes of our people? It gets tiring, doesn't it? I mean, I get tired trying to educate, trying to support, trying to open up other ways of thinking and potential of our people in a way that I'm hearing you do too. So what are some effective ways that you've found to achieve that?
Yeah. Well, I think first off, I think it's helpful for the people coming to seek assistance is to understand that sitting behind me and my team experiences that mean that compounding nature of frustration means that we may not be as helpful as you think we should be. It's not intentional. It's that we find this personal work. This is personal work. It's not Mele down the road. Mele could be my friend's sister, you know? And so I recognise that it takes courage to come and ask when you don't know. And therefore it can be difficult when the response is not the response that you need as a non-Pacific person coming to seek assistance and being met with, are you kidding me? So I think that takes patience on the learner's part. The second thing I think is to be able to empathise, to understand what these communities are like. So when you're developing something for a food environment in Pacific communities, have you been to Otahuhu at 11 o'clock to see how many people are eating chicken and chips and how full the takeaways are? Because that gives you an idea about what the response might need to be. And it's those people you need to talk to develop those responses. And we can absolutely provide a link with those communities. But if you don't go in there yourself and see it, not from a judgmental point of view, say, oh, look at all these fat islanders eating. We do that ourselves to have a laugh, but, you know, but to understand what drives them there, what they're doing, I mean, that is really important too. So empathy, gaining experience firsthand without judging, and then talking to people about what your observations are, and checking yourself, feeding that into policy. And then I think, well, those two things, I can't think of a third one. I have a bit of time.
Yeah.
I mean, I guess when you go to another country, you learn about how that country, you know, like I see someone who goes on holiday to Fiji, comes back the next week and say, bulla, bulla, bulla. And I think that's a good thing. It's then how do you apply the learning? It changes, you know, you go to another country, it changes your diet, it changes because you get exposure to other food. You might go to Thailand, start eating Thai food. I think you can apply the same kind of thinking here, not just around food, but if you go into a community, you experience that community. Yeah, so I might be talking a bit around in circles, but...
I think it's important to emphasise the points you're making around all of those spheres, around all of those sites, because it is about illustrating some of the daily aspects of life, what people see around them, and then how tightly defended people are. As you said, you know, people are very, very sensitive about being accused of racism. It's a heinous crime to be accused of racism, and people will push back, won't they? Very strongly. No, I'm not racist. That's not racist. So, do you have a sort of working definition of racism that you use to try to broach that divide when you're trying empathically to help people understand that what they're bringing forward is racist, to help them unpack, maybe get around their defences around that?
I mean, and I think a lot of my Māori and Pacific colleagues are like this too, would very rarely use the term racism or racist to a person that expresses that behaviour. We might to each other, and then and that person is really racist, like watch that person, and you know, there's a collegiality where you tautoko each other. So I'm reluctant to use racism because of exactly the reasons that you've highlighted, that people deny it and don't feel comfortable with it. And I think about my own children, because they're so woke now, that even things that I say, they'll say, oh, Mum, that's racist. And I go, what do you mean that's not racist? So, you know, things like, oh, man, the guy had a 10-gallon hat and no Indians. He thought he was the boss. And they're like, Mum, that's racist. I'm like, that's not racist. Then I think about it and go, oh, maybe that is, you know, like I should stop saying that. So then I think, okay, so he had a 10-gallon hat and no cattle. And they're like, yeah, that's better.
Right.
So I think it's just when someone raises it with you, or I don't know, I think you can sense resistance. I can be overt, but I wouldn't say that's racist.
Right. And that's certainly what the research suggests, is that when those terms are used, is it's not helpful in the interpersonal context. But that we do need to get more comfortable using those terms at the institutional, at the structural level, to call out the histories and the ongoing perpetuation of colonisation, to hark back to what you said earlier. Do you think that is a useful frame, or what language do you use at the policy level?
Interesting, I'd probably use everything but racism, unless it's overt, like melee.
Mm-hmm.
I think I did with one example where I said, actually, this is really offensive and quite frankly it's racist. And I could see the looks of aghast on everyone's faces. So when it's blatant, then I will. But for the most part, I just try to give examples of how to frame things more positively.
Mm-hmm.
Yeah, that might be. Often identifying racism is very difficult for the person who's experienced racist behaviour.
Yeah.
And I think it's sometimes unfair to expect them to call out the behaviour.
Indeed.
I'm happy to call it out for other people that experience it, but I wouldn't call it out on myself.
It's a really horrible tension, isn't it? Because when people are experiencing it, racism, in the now, interpersonally, or at a systemic level, through how school policy or housing policy or the norms that have been established over many years are affecting people, that when people try to name it, they are often reluctant, ironically, because of the very racism that they're trying to speak about.
I think there's also a perception that you're the angry brown woman. And these are things that you're always kind of countering, which is racism in itself. And no one will ever say it, but you can feel it in a room when you've said, this is not appropriate. And then you just feel that, okay, or you walk past people in the hallway and they avert their eyes or they look somewhere else, you become too difficult to deal with. So you feel a huge amount of responsibility to come up with a wide range of strategies to address racist behaviour so that it doesn't impact on the communities that you serve through the manifestation of policy.
Yeah.
And then even, I guess, from a patient point of view, you know, Pacific women are diagnosed much later in the disease pathway than non-Pacific women for things like breast cancer, ovarian cancer. Part of that is Pacific women not engaging with the system, but part of it is also late diagnosis because they aren't offered the same range of services to get those diagnostics done. So, so it's both in policy, it's in service delivery, and then we get these really pervasive health outcomes.
You've got some lived experience of that too, so you know that from the ground up. But what are some of the solutions that you've identified that might be helpful there? Because on one hand, and I really resonate with what you're saying, I think we feel quite trapped. You know, we're trying to make things better, we're trying to educate, be compassionate, be empathic, and at the same time we're operating within quite a narrow field because the people we're trying to communicate are incredibly well defended about their views. And at the same time our people are getting sick and not getting the services offered as they need them, in the way that they need them.
You know, I'm not sure if I'm going to answer your question, but most of the Māori staff that I come across, the Māori women that I come across in the ministry are phenomenal.
Yeah.
They are incredible. And they're smart, they think collectively, they think they've got experience of our communities, they are solution oriented, they are disruptive, they're really well qualified. And why should they have to struggle to share these views and to share their expertise and have their input valued? So if people could see what I see in our Māori staff and our Pacific staff, and they valued what they had to offer, automatically that would make a huge difference. And I know that, you know, I work with good people, a lot of really good people, Māori, Pacific, non-Māori, non-Pacific. And I know that a lot of them would say, oh, she's not referring to me. She must be referring to this other person. And I may not be referring to you, but I could also be very well referring to you. So I think just be very self-aware and, you know, really go out of your way to seek the perspectives of these people that are working in the ministry, that have come from grassroots communities, that have whānau and family, that experience the problems that you're trying to solve, and ask them, what would you do? That would make a huge difference.
Yes.
And actually be open to what it may mean you might have to spend a bit more money, and you may have to think in a whānau-oriented way, and it may mean that doesn't fit the way that you do things at the moment. But I think it'll be really rich.
Absolutely. And so there's quite a few maybes in there, and I'm interested in what are the things that tip us into making that the norm. You know, you're saying if people could only see what you see, these brilliant women and men, who are role models and advocates and are super smart and work strategically and collectively to get things happening. But many of them are not visible. You know, we have representation, but do we have enough? Do we need to be more visible? How could people see the people that you see so that their impact and their visibility could be maximised?
Yeah. I mean, first thing is see them, because they're there. We could always do with more. And if I think of, you know, I've got experience of when people will say to me, oh, he's not quite at the level. Or a bit raw, you know, like doesn't really put things in a professional way when he wants to express himself.
Right.
So, you know, talking about particular staff. And then, you know, take that person into a meeting and they're like, well, I didn't like this contract because the contract's bullshit. It's going to do nothing for our community. And that is perceived as raw, as unfiltered, or negative. But yeah, I don't see that as negative. It's just saying it like it is. Yeah, so I don't know if I'm answering your question, but all I see is that the people are there. They're often just not heard. They don't want to hear what they have to say. And often these people can change your language from just being language of equity, that we have to do it because it's equity, to behaviour of equity. They can be the point of difference. They can tell you how to do it differently.
So do you have any particular dreams for how we get rid of racism in Aotearoa? Do you have a particular pathway in mind that you are navigating?
I mean, to be honest with you, I just bring it back to my children and want them to have a better experience than I've had in life. I have one son who is brown and one son who's blonde, and both of them have very different experiences, and I just don't want them to have to experience that disparity. So I'm sure my parents would have thought the same for me, that they don't want, being in an interracial marriage, that they wouldn't want me to experience racism. So I can't think of what I'll do going forward on a personal level. And even just sitting here talking with you makes me contemplate about whether I should be calling it out more strongly.
Ka pai. Are there any things, reflecting on our conversation just now, maybe that you can imagine in your role at the ministry that you could start to work on in the short term to bring conversations about racism into a more kind of deliberate, conscious space, into a more visible part of the workings of your team?
Oh, there's absolutely, and I do think that in a leadership role that there are things that I could do to help facilitate the conversation and to take personal responsibility for that. But interestingly, I never thought about it because I always feel like I have to do things by stealth and in a clandestine way, because by bringing it to the front is not going to be well received. However, I do think that having healthy conversations and making it normal is probably the way we need to go to now, so that people don't feel threatened by it. And the way to do that is to normalise the conversation, so absolutely.
Ka pai. Oh, ngā mihi nui ki a koe te rangatira. Thank you so much for sharing your wisdom with us.
Thank
today.
you.
Kia ora.
Kia ora.
Kia ora, thanks for watching. If you want to learn more about this kaupapa, check out our website. A tōna wā.